Hello, I am Dr. Lemus-Rangel. Thank you for taking the time to see this video and for considering our team in your search for a life free of reflux. Our team provides the most advanced and effective surgical treatment for reflux and hiatal hernias. I utilize the position of the Da Vinci robot to repair the hiatal hernia. Then, one of my gastroenterology colleagues performs the TIF portion, which is a transoral procedure to eliminate reflux. My part of the operation takes less than an hour, and the TIF part takes another hour. The most important aspect of your treatment is the strict diet after the combined surgery. I usually spend a great deal of time discussing the dietary changes that each patient must follow to have a smooth recovery. For the first 10 days after the surgery, you must only drink water, Gatorade, Boost, Orange Sugar, or any protein shake you wish. You must crush any pills you need and combine them with the protein drink. You must not eat anything else. It's very important that you adhere to this diet, as you will have a fair amount of swelling from the surgery between your esophagus and the stomach. After the 10 days after your surgery, you will have a diet routine which is outlined in a dietary pamphlet that we will review in the office. Within the first week after the operation, your reflux symptoms will markedly improve to the point where you will no longer require medications. Most patients achieve a new normal eating routine between 2 months to 6 months, so please be patient if you aren't eating a regular diet within 1 month after your surgery. You should be able to return to work usually within 7 to 10 days. I will discuss what that will entail depending on your overall medical conditions. We look forward to meeting you and answering all of your questions. Have a great day.
Cavity. Although most people with a hiatal hernia do not experience any symptoms, others may suffer from recurrent symptomatic reflux requiring medication or even surgery. Surgical repair essentially involves pulling the stomach back into normal position fully below the diaphragm and making the opening in the diaphragm smaller. A mesh is then placed over the incision to reinforce the closure to minimize risk of hiatal hernia recurrence. Sedation, the esophagus device is introduced into the mouth under endoscopic guidance and threaded down into the stomach. The endoscope is then angled so complete visualization of the LES site is maintained at all times. The device jaws are then folded into its active state. The stomach wall is then retracted into the jaws of the device. If a small hiatal hernia is present, suction provided by the endoscope can be used to reposition the hernia below the diaphragm before device activation. Once the stomach wall is positioned correctly, the device can be activated like a stapler, resulting in fasteners being deployed to hold the stomach wall in place and secure the fold. The stapling is then repeated in multiple specific locations to recreate a natural functional sphincter. With healing, scar tissue develops which further secures the newly formed valve.